Right, WHO experts who led the mission on COVID-19 origins in Wuhan are briefing the media on their report. Let's take a listen in on that much anticipated report. We take you live there now.
Looking at cases of fever, cases of unspecified pneumonia, ILI and RE systems, which are respiratory syndromes that are picked up by different health facilities. So we look at more than 76,000 cases of these symptomatic individuals in the months before December to try to look if anything there could look like COVID cases that had not been picked up before, but at the end of the day, we didn't find anything. But this is only a first set of studies, and among other things, our recommendation is to look back in more detail into many of these data sets. We also look at the data around the confirmed cases in December 2019. The 174 cases we know were confirmed at that time in Wuhan. And there clearly, during the second half of December, we could see a surge of cases, both among the ones linked to the market, but increasingly as we move towards the end of December, increasingly cases not linked with the market, indicating that the disease was already at that time spreading outside in the different part of Wuhan. Therefore, the more we move into the second half of December, the less relevant the market itself become, because then the disease is spreading around. We also look at data from mortality statistics data to see could we see any excess mortality, any sign of an excess number of deaths in the period before December 2019 in and around Wuhan and also elsewhere in the province. And we could not see anything happening before December. And clearly looking at this type of data, we could see that an upsurge of mortality in the numbers of deaths somehow in January, towards the start of January 2020 in Wuhan, compatible with the fact that the number of cases was growing already at the end of December in the city. And we also could see that outside Wuhan, this increase in mortality came a little bit later, indicating again that the event, at least in the province, started in Wuhan and then moved more and more outside Wuhan. We also look, of course, at the market, the Wuhan market. We went there, and it's a closed market now for more than a year, but it was still very interesting to see the setting, to see the state of the physical environment in which these events unfolded more than a year ago. And we also were able to map the entire market. It's a huge market with more than 1,500 vendors and shops, and mapping all of them with the different type of product they were selling, different type of meats, poultry, seafood, wild animal meat, etc., and could link that with both the positive environmental samples that were found in different surveys in the market, but also with the human cases, in particular in the early days of December. And by putting all these data together with the sequencing data, we could show that the virus was circulating in the market as early as the beginning of December 2019. But there were also cases not related to the markets outside the market of the Wuhan market, with slightly differences in the genetic makeup of the virus these cases had, showing that there was probably some circulation in different parts of the city unrelated to each other. And remember, the cases we picked up in December 2019 when only the severe cases. At that time, a COVID case was a case of severe pneumonia. All the mild cases were missed because they were not, at that time we didn't know that there was many mild cases or even asymptomatic cases. So all these other cases were never picked up, and of course they could help us get a much better understanding of the start of the epidemic if we had access or could detect these cases. We were also able, for each of the interesting vendors in the market, we were able to trace back their suppliers, in particular the shop selling farmed wild animals of much interest in our work. We could detect or identify the suppliers they were using all the way back to the farms, providing and raising these animals in different provinces of the country, and in particular in some provinces where we know that bat population of interest are also there. So clearly pointing into interesting new studies to be conducted in the coming months. So again, this is only a first start. We've only scratched the surface of this very complex set of studies that need to be conducted, and we have pointed to many additional studies that should be conducted from now on. We were also able to do a lot of analysis on the genetic sequences of the virus that were isolated in December and early January at the start of the epidemic, and being able to to see how these sequences were linked in evolution, meaning helping us to understand and try to understand where and when the start of the presence of the virus could be related to. And you will see that in the report. There is a lot of very detailed information and useful information that again point towards the need for very specific new studies. Chinese counterparts ahead of our coming were also conducting a large number of surveys on animals, different type of animals, wild animals, animals from zoos, animals from farms, domestic animals, etc. Dozens of thousands of animals were tested and all negative. So again, showing the difficulty of picking up a particular species as a potential intermediary host. And we also look in the process of helping us to prioritize our recommendations and prioritize studies to be conducted. We also looked at what are the different possible pathways for this virus entering the human population back in 2019. And that helped us organize our thoughts and prioritize our recommendations. And there we looked at 4 possible pathways for the introduction of the virus. One was a direct introduction from a host animal, from a reservoir, and that could be a bat or other animals where the virus had been initially present, directly into the human population. Then we looked at this scenario together with an intermediary host, meaning the virus would have first jumped into an animal, adapted into that animal population, and then jumped and adapted to the human population. And then we also look at the possibility of frozen food products or contaminated products being a vehicle for the virus, allowing the virus to enter in particular the Wuhan area from further away. And there this interesting lead into frozen farmed wild animal products present and sold in the market, in Wuhan markets, are very interesting and warrant further studies to explore that hypothesis. And the last one, of course, was the possibility of a laboratory accident or leak. And in doing so, we looked at all the argument for and the argument against we had for each of these hypotheses or each of these pathways. And we tried to stay to what are the arguments we have, the hard facts we have. We try to stay away from suspicions, ideas, theories, and so on, because we couldn't really use that in a systematic way for all the hypotheses to help us moving forward. And there in that process, we then assessed the likelihood of each of these possible pathways and organized our recommendation towards the ones that were, as an outcome of our work, the most interesting to continue with. And in particular, with regards to the current joint group, the joint group of experts between Chinese experts and international experts, where and how this group can best and in the most useful way conduct the necessary additional studies in better, again, exploring certain of these hypotheses and improving our understanding of the source of the virus. In closing, I'll just say that it has been an incredible experience. We really learned a lot. You will see, if you dig into the report, it's a huge report. Can understand the challenge of going through that in a short period of time, but it's a huge report with a lot of new knowledge, a lot of data, a lot of new information, and I think a lot of work will continue to come out of these initial studies. We also, of course, have to thank hundreds and hundreds of people who made this work possible, both in the host country in China, facilitating all our work, gathering data, generating data together with us, but also huge logistical challenge to get us to Wuhan and stay there for a month. As you know, traveling these days is not easy. Bringing an entire team from outside is not easy. So it has been really a challenging time for the whole team to get there, do the work, and came out again. So on this, I would like to thank you all and give the floor over to Tariq. Tariq, over to you, please.
Thank you very much, Peter. Just two technical things. First is Dr. Benembark has used some slides that those who are on Zoom were able to see, but those following us through broadcasters or through social media were not able to see, and we may send these slides for everyone to be able to see them after the press conference. I also understand that for journalists who are on Zoom, they have missed the introduction that I made, so I'll just briefly repeat that the report has been posted some 15 minutes before the beginning of the press briefing at the webpage, and we have sent the link to that webpage alongside with the press release to our media list. You may contact media inquiries at www.int if you have not received any of that. Just to repeat that we have 10 scientists with us, and I will read one more time the names for journalists who have not heard me the first time. So Professor Dr. Thea Fischer, Professor John Watson, Professor Dr. Marian Koopmans, Professor Dr. Dominic Dwyer, Vladimir Datkov, Dr. Hung Nguyen, Professor Dr. Fabian Lendertz, Dr. Peter Dajak, Dr. Fargal Mubashir, and Professor Dr. Ken Maeda. Their affiliation and places they work normally you can find on our website. So after these opening remarks from Dr. Peter Benembark, we will go to the three co-chairs of subgroups. So first we will start with Dr. Thea Fischer, who was co-leading the group on epidemiology. Professor Dr. Fischer, the floor is yours.
Thank you very much, and thanks so much for a very strong presentation made by the entire team, but presented by our team lead. It's a pleasure to reach this day with the final publication of the report. And I think Peter has already really worded it very well. So from the EPI side, I would just like to underscore the main findings. They are our preliminary findings, of course, as this is just the very first step on a expectedly long trip to find the origin. But we have managed to come quite far with the joint work. And you have to remember this is based on 28 days of international travel to Wuhan, of which only 2 weeks, 14 days, were working actually jointly together in the various teams and in the entire team. So from the EPI side, we have been reviewing thousands and thousands of data points. We have reviewed data points of respiratory surveillance data. We have reviewed data points of mortality data. We have looked at pharmaceutical data. And we have looked specifically and zoomed in on the already known early cases from December 2019 in Wuhan, all in all trying to get as much information as we could, looking for early cases, looking for previous smaller epidemics that were not yet identified. We have really scrutinized the respiratory data, and so far we have not been able to document any substantial transmission of SARS coronavirus in the month preceding the outbreak in December. However, we cannot exclude that there have been milder cases and there might have been smaller epidemics that have gone under the radar, as with our current knowledge of COVID-19. Some of these cases, and that's actually the vast majority, they might only have mild symptoms. So this is indeed a possibility that we cannot exclude based on the current findings. And we have made a substantial amount of recommendations. Some of the data we will recommend to revisit and re-review jointly, and that would be the next step forwards. And in addition to that, some of the very important recommendations are also that we will jointly undertake a serology study looking at blood donors who are otherwise healthy people and look for any traces of SARS coronavirus antibodies in these populations in the months preceding the outbreak. So all in all, many important first preliminary findings, many important joint recommendations for the next steps, and we welcome the questions you will have to the work we have today presented here, both in the presentation and in the report on the joint EPI and the joint international team. Thank you.
Much, Professor Fischer. Now we will go to Professor Dr. Marion Koopmans, who was co-leading a subgroup on molecular epidemiology. Doctor?
Yes, thank you, Tarek. Also, very briefly, so just to emphasize that part of the work in the molecular epi team has been trying to see what we can learn from bringing together virus genomic data. We've all learned in this pandemic how important genomic data can be. We are seeing that used every day now. So we've really done an effort to look at the earliest available data, bring that together from different laboratories, and going back to the original data and reanalyzing them to see what are sort of the golden sequence data from that first episode and what can we learn from that. And that may seem like a very simple endeavor, but in reality it is not, because molecular data are generated in laboratories and they are released, for instance, through the global database GIS8, but then they are not linked with the patients that they came from. So that was a piece of work that was needed in order to really see how the molecular data could help reconstruct the early phase of the pandemic in Wuhan. And the key conclusion there supported already the findings from the epidemiology that the market in Wuhan has been an important amplifier event, but that there also already, at the time of those early cases, was some virus diversity, telling us there was some chains of transmission missed. So we have to dig back a little bit further. And then there's also so what was summarized is all the genomic data that is out there now, also from animal surveys before 2020 and since, and what we can learn from that about plausible hypothesis for reservoir species. And all of that is described. So I will leave it at that.
Thank you very much, Professor Koopmans. And now we will go to Dr. Peter Daszak, who was co-leading the subgroup on animal and environment. Dr. Daszak.
Very much. Just briefly, two points. First of all, as you read through the report, you'll see quite a significant amount of work that's been conducted since really the very beginnings of this outbreak in China, to try and trace back the animal origins, including over 900 swabs in the Huanan seafood market, tens of thousands of samples of animals collected, tested around China, different types of wild animals and livestock, bats in the province, Hubei province where Wuhan is. And the second thing is to put the animal work in the context of both the human epidemiology and the molecular work that you see in the report. It all connects together in a true One Health way. And what we do see are some clear links, some clear pathways by which this virus could have taken, that all of the evidence suggests are plausible, and some that are less plausible. And I think that's how you read the report, and I look forward to answering every question you have on this issue. Thanks.
Thank you very much, Dr. Daszak. So now we will open the floor for questions, and we have many of them. So please, if you can introduce yourself and ask only one question. As you know, for this press briefing, we don't have a translation interpretation available, so it will have to be in English, although many languages are spoken here, but let's try to for others to be able to understand. So let's start with Isabel Sacco from EFE, Spanish news agency EFE. Isabel, unmute yourself and please go ahead.
Good afternoon. Thank you, Tariq. The report mentions the possibility of circulation of SARS-CoV-2 in other countries even before the first case was detected in Wuhan. So how, Dr. Mbarek, do you assess the possibility that the origin of this new coronavirus was somewhere else but not in China? Thank you.
Thank you for your question. We don't think that the possible findings of indication of earlier circulation elsewhere outside China is incompatible with the current scenario. It is perfectly possible that you would have earlier cases, sporadic cases circulating in and around Wuhan before December, let's say November and potentially also October 2019, and potentially that some of them were also traveling abroad and seeding and transmitting the disease abroad again in sporadic way elsewhere during November and earlier December. And so that could be possible. Don't forget that Wuhan was a major international hub at that time with direct flight every day to most parts of the world and most big capitals of the world. So that earlier move of the virus outside of the area could potentially be explained that way. This being said, until we have more data, more firm information or results pointing into that direction, the current thinking is still that we are looking at the start in and around Wuhan and moving backwards, trying to find out how it came there, and whether it came from another part of China or elsewhere. That will depend on the further studies and research. But because of the strong suspicion of certain bat species being the host of this virus and having found other relatively close virus strains to SARS-CoV-2 in the region, also in Southeast Asia in general, where these bats are living, is a strong indication that that's where the source is. But we're still working on finding the exact traceback of the virus before Wuhan. Thank you.
Thank you very much, Dr. Peter Mbarek. I understand Professor Koopmans would like to add something.
Yes. So maybe to add that, so there is of course, the plausibility of bat viruses in geographically neighboring countries. But there's also two pieces of information that really also are why this recommendation is there. One is that if you look at the earliest sequences, there is already clusters of identical viruses in two other provinces in China. And the second is that there is some literature from outside of China, particularly in Europe, that is suggestive of earlier circulation although the methodologies there really need some scrutiny. But because of that literature, we have said, well, we need to keep an open mind and be sure that those types of pieces of information are also explored further.
Thank you very much, Professor Koopmans, for that. And we will now go to next question, and that's Radio France Internationale, Jérémy Lange. Jérémy.
Yes, thank you, Tarek. I'd like to know more about the missing data that you're looking after. How confident are you that China will transmit those data to upcoming missions to Wuhan if they ever happen? And would you say it is likely, possible, or extremely unlikely that China did try to hide some data to you?
Thank you for this question. Yes, as we said, the amount of data generated all the way up to our arrival, and while we were in quarantine, in fact, colleagues in China were still generating data as a follow-up to some of our initial questions. So there was an incredible amount of data being generated. We got access to quite a lot of data in many different areas. But of course, there are areas where we had difficulties getting down to the raw data, and there are many good reasons for that. In China, like in many other countries, there are restrictions on and privacy laws that forbid the sharing of data, including private details to outsiders, in particular if the data are moving out of the country. That would be exactly the same in most countries in the world if we were going there to do any studies, and we've done many studies in the past, and we always face the same challenges. How much and how can we share critical data with outsiders? But also because there was a large amount of data, don't forget that some of these data sets, the one looking at 76,000 individuals, these were generated by hundreds of different healthcare centers, by thousands of medical staff, and just the fact of being able to extract and put all these data in a way that you could have easy access to the raw data is a challenge in itself. So therefore, where we did not have full access to all the raw data we wanted, that has been put as a recommendation for future studies. So the idea is that because we didn't have time, or because certain authorization need to be given before we could get access to this data, all that will be and could be done in the second phase of the studies. And then for the likelihood, I think it's clear that for us, we were engaging in discussion. We got access to a lot of data. We were asking a lot of questions. They were, as I said, challenging for sharing some type of data, and we are working towards finding solutions on how we can get access and share this data in phase 2 studies. So I see that again as a continuum in working closely with our Chinese counterparts on making best use of all the data that is out there. Thank you.
Thank you, Dr. Benenberg. I understand we have 2 team members who would like to add a few points. Let's start with Dr. Han Nguyen.
Thank you very much. I agree fully with our team leader, Peter, on this point. I just want to add that people might need to realize that this is very short mission, and we, as a team between WHO expert and China, would really try to come up with some conclusion on the current status of knowledge. We can wait more and more to have more data, like Peter said, to come up with more conclusion. But I think that in this mission, I think that we really, at the end of the mission, working from both sides, did kind of qualitative risk assessment of different scenarios and pathway of likely transmission. And with different type of data, you can see from 3 lists, and Peter mentioned before, we came up with this ranking of likelihood. So in short, I think that is very important as scientists really to come up with something with the availability of data to really, respond to the urgent situations that we want to know about this disease. Over.
Thank you. Maybe last comment from Dr. Peter Daszak.
Briefly, I think if we look at the amount of information, new data that's in the report, and just thinking about the animal side, tens of thousands of samples tested that have never been published yet. Over 900 swabs from the Wuhan seafood market. The data's not been published anywhere else yet. And in the process of doing this work, we did go backwards and forwards with the China team and asked for them to do further analyses, provide more evidence, more information, and they did that. So I don't think it will be a problem to continue this momentum. If we look at the recommendations, China has agreed to follow those recommendations, and we really look forward to continuing that work. If the current report is anything to go by, we should expect to see significant new amount of information coming out in the future.
Thank you very much to all three team members on this answer. Now we will go to Xinhua News Agency, and we have Du Yang with us, if I'm not wrong. Can you please unmute yourself and go ahead?
Yeah, can you hear me? Yes. Okay, thank you for taking my question. What would WHO comment on the cooperation from the Chinese professionals and colleagues during the mission in Wuhan? Is there any plan from WHO to further the study on the animal source of the SARS-CoV-2 virus, or to send a mission to countries or regions other than China for the study? Thank you.
Thank you very much for this question. I think the size of the report and the amount of material and results and analysis and data in the report speaks for itself in terms of how the collaboration went. There would never been anything like that if we did not have a very strong and good collaboration with our colleagues in China. We would then have ended up with a very small report with very few results, very few studies presented. So I think this speaks for itself, and just look at the amount of results there. That will tell you everything about the depth and the intensity of the collaboration between the entire members of the whole members of the team. This being said, it's clear that there is still a lot of work to do. There is still a lot of studies and good leads that are in the recommendation of this report. This is a set of recommendations that comes out from the joint team, from both sides, from all the members of the team. Everybody stands behind these recommendations, and we anticipate that many of them, if not all of them, will be followed through and will be implemented in the coming weeks and months, hopefully. Because we owe to the world to find or to get a better understanding of the origin of this virus. This virus has really created havoc on the planet, and a crisis we have never experienced before, any of us. And really, this is the minimum we can do, is to try to understand what happened, how it did happen, why, and try to prevent something similar to happen again. Thank you.
Thank you. Professor Koopmans, would you like to add something?
The question was addressed to WHO, but maybe as part of the external scientist team. It's good to explain how that collaboration came about. So we were starting online in many meetings before the departure, then had a lot of online meetings during our quarantine, and then had 2 weeks where we were able to meet in a big room face to face. And that's, of course, what you need to really get to know each other better and to work better. So I think it's really important for everyone to realize that it takes time to build up a collaboration, a spirit in any project, whether that's in this situation or in a new project that you run at home. And given those limitations, I personally think we've come very far in the collaboration. And then your question about studies in other countries, I think that already came across earlier in one of the questions. So what we said, we need to follow the leads. We cannot just go speculation, but we need to follow the leads. If there's a lead from a supply chain tracing back to another country with, let's say, wildlife products, that would be a potential lead. And then yes, then that would guide where to go for those studies.
Thank you very much. We will now go to Sarah Newey from Telegraph. Sarah?
Hi, thanks for taking my question. I've seen the comments from Dr. Tedros to member states this lunchtime or earlier today, and he talks about the lab investigations into the lab not being extensive enough. I just wonder what your reaction is to that, and is that theory still going to be explored in future studies? Thank you.
Thank you for your question. As you know, the team was a team put together to do joint studies into the zoonotic origin of this virus as per the World Health Assembly resolution of last May. In collaboration with our partner agencies, and this is what we put together and initiated starting last July, and will continue in the coming months. We looked at the different hypotheses as I outlined earlier on, among others the lab incident possibility. This is the first time that we have been able to discuss openly this possibility. Initially, it was just speculations all over the place, as you remember, throughout 2020. Now we have a process to discuss it. We've put it in our report. It has been assessed, and of course, since this was not the key or main focus of the joint studies, it did not receive the same depth of attention and work as the other hypotheses. Also because that was the assessment that it was not something where we could see strong indication that was something we should look into. And therefore it was ranked as the least likely, so to speak, of the four possible pathways. Not saying that it was impossible, but not the one we would start initially going deeper into and focusing our attention on. But this being said, of course, if others and if there is a need to further explore this and potentially other hypotheses, of course we will continue to look into this hypothesis. We have also all along said that as soon as there is new data, new evidence, new information for any of these hypotheses, we will put that into the assessment and reevaluate any of these hypotheses. So it should not be seen as a static product. It's a dynamic product. It will be fed by the result of new studies, of new evidence coming up, by new analysis, and therefore it's important that the entire world is supporting this work, is contributing constructively into the analysis, into the studies, supporting them, etc. So we collectively can get through it and get to the bottom of this event and better understand the origin of this virus. Thank you.
Thank you.
All right, that is the press briefing by the international team studying the origins of the coronavirus. Just a few pointers there. They're admitting that they've only scratched the surface with this research, and that there's a need for more specific new studies, and that thousands of animals were tested and all were negative, and that thousands of data points were indeed reviewed, and a lot of information coming from colleagues in China who assisted a great deal in collecting data. So that's some of the information that's coming out of that briefing. Let's take a short break. I'll be back at the top of the hour with your headlines. Do stay with us here on SABC News.